Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thanks for joining us. I'm going to have a conversation with Audra Moran and Susan Layton, winners of the Cancer Community or C2 Award. They're joining us on the program to talk about the work that they're doing in oncology and also in their communities related to oncology and the fight against cancer. Welcome both Audra Moran and Susan Layton. Thanks for being here.
Thank you, Neil, for having us.
Just a bit of background about yourself, Audra.
Mm-hmm. Sure. I am the president and CEO of Ovarian Cancer Research Alliance. I've been with the organization about 9 years.
And Susan?
Sure. I am the director of the Survivors Teaching Students program, which is part of the Ovarian Cancer Research Alliance. And I'm also a 22-year survivor of advanced ovarian cancer.
Both of you are winners of the Cancer Community Award, the C2 Award. Can you tell us a bit about this award, Audra?
Absolutely. It's part of the Your Cancer program, which is a partnership between AstraZeneca and Scientific American. Mm-hmm. We're actually the inaugural award winners, and we are thrilled to have received it this year. You know, often in doing our work, we don't receive a lot of recognition. We know that what we're doing is great and that it's certainly helping people, but to have this external validation and last night to be able to actually meet people and to say, you know, thank you to the people that are giving us the award, it was truly an honor.
So what type of work is it that you're getting these awards for?
Well, the criteria for it, I think, was recognizing change makers in cancer care and making sure that our sole criteria for the President's Award was making tangible and inspiring differences in patients' lives, and we have a program that we feel does just that.
And that program is the Survivors Teaching Students program, which I'm the director of and which I'm so very proud of. We have over 900 volunteers who are survivors and caregivers, and we take them into the classrooms of medical and nursing students across the country to teach them about the disease of ovarian cancer. It's a disease that's very, very hard to detect because there's no screening test for it. So it's really important that these young students begin to learn and understand how the disease presents. And to hear it from survivors is so eye-opening for them. They really begin to understand the disease, and they walk out of the classroom with a much better understanding, and we feel that when they get out into practice, they'll be able to identify the disease earlier when it's more treatable.
And these are really students who have not yet selected their specialty, so we think that we're just reaching a large swath of people that someday, if they happen to encounter a case of ovarian cancer, they'll recognize it, and so we think that has a lot of impact.
So you basically have people looking out for each other, and you've got the students who are telling other students who are talking to their parents, and parents are talking to parents, the whole community thing.
Absolutely. I think it's involved on every level. The survivors are involving their families. Caregivers actually also give some of these presentations. But most importantly, we're getting into that medical community. And ovarian cancer is technically a rare disease, and some of these doctors may never see a case. But if they do, we want to make sure that they know how to identify it.
Now, and Neil, you spoke exactly to the right thing. We have reached over 75,000 students with our program. And if you stop and think that if every one of those 75,000 students has gone home and has talked to one woman, we have made a huge impact.
How many women are dealing with ovarian cancer as we speak?
Well, there's about 22,000 women diagnosed every year, and sadly about 14,000 of those women will die. It's a very deadly disease. It's actually the deadliest of the gynecologic cancers. About 1 in 72 women will be diagnosed with the disease.
And is this something that can be early onset? Is there something that we can do to detect earlier?
Well, Susan can probably speak to some of obviously the symptoms. The symptoms, however, are very vague, and that's why we teach doctors to also recognize the fact that if a woman comes in and reports some symptoms that, many women have, which might be, bloating or having difficulty eating, and those are things that, every woman's going to experience at some point in her life. So I think with our program, if we can indicate to a doctor that if this is recurrent and going on for a long period of time, that this is something they should think about as a diagnosis, if you will.
Yeah, definitely they need to be aware of, women need to be aware of their own body and understand that if something's new and different for them and it's not attributable to some other condition that they may have, they need to ask their physician, can you rule out ovarian cancer?
And it is important to note that pap smears do not test for ovarian cancer, and I think that might be a myth in the community that we love to dispel because it's just not true.
Was there a point, Susan, at which you really took control of how you were talking with your physician? What was it about your treatment that saved you?
Well, one thing, when I was diagnosed, went to my family doctor, and I had been treated for a number of benign conditions. Mm-hmm. He came up with every excuse for my symptoms, and what really saved me was when they did an ultrasound, they found that there was something going on, and they referred me to a gynecologic oncologist, which is the crucial part of treatment for any ovarian cancer patient. They need to be treated by that specialty, and honestly, that's what saved my life.
So I guess if you've got any advice for women who are dealing with something that's abnormal and not attributable to some other condition, would you say rattle the cage of your provider to take it a step further, even though they may not think it's as serious as you do?
That is totally correct. I always encourage women to take a symptom card with the symptoms of ovarian cancer with them to their doctor and say, prove to me this is not ovarian cancer. Do something, prove this to me.
And discuss your risk with your doctor. Yeah. Many doctors don't seem to follow up and ask you about first-degree relatives and whether they've had breast or ovarian cancer. Those are important questions. And if you know your history, you really need to make your provider talk with you about that.
Now, briefly, in wrapping up, back to the awards, I understand that there are 4 different categories, and which did you receive and win for?
We won the President's Award, which is given specifically for making tangible and inspiring differences in patients' lives.
And the other categories?
There were several. One was for precision medicine. One was for better treatment for families going through this. And it was really about the collective difference when the community comes together. I think all the awards, that was the common theme that wove them together. And
I understand that there are some charitable donations for cancer nonprofits that are involved with these awards as well, yeah?
Yes, absolutely. And we were the lucky recipient of one of those, so we were thrilled. If you want more information, you can go to yourcancer.org. That's exactly where you can learn more about the awards. And also, if you want to learn more about our organization, you can go to ocrahope.org.
Great. Well, I thank you both for joining us on the program this morning. It's been a pleasure and an honor. Thank you, Audra Moran and Susan Layton. Thank you both for joining us today.
Thank you very much.
All right. Thank you.
You've been listening to Health Professional Radio. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. And be sure and visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.